I bring the best of both worlds in terms of working both in Hawaii and the Middle East. Hi, this is board-certified plastic surgeon, Dr. Shim Ching, and I'm going to be talking to you today about practicing both in the Middle East and in Hawaii. I've been going to the other side of the world for about 15 years now. I first started in Kuwait, then I started to work in Dubai, and now Doha and Qatar. I really feel I've brought a unique perspective to my patients in the Middle East after practicing in Hawaii. As everybody knows, in Hawaii, it is summer all the time. People are very free with their bodies. People want to go to the beach and have minimal scarring after any sort of cosmetic procedure. So during the last 25 years where I've developed my skills and experience as a plastic surgeon, I've really tried to minimize scarring. For example, I do a scarless breast augmentation where the incision is hidden in the armpit so that there's virtually no scarring. My patients in the Middle East have never really heard of this, and this is something that I do quite a bit in the Middle East because patients really appreciate the minimal scarring that this procedure gives them. In addition, I'm always hiding scars. I'm locating incisions in areas that just can't be seen or using very minimal incisions in Hawaii just because people are so conscious of their bodies and want to minimize their scarring as well. Bringing these techniques to the Middle East has really helped minimize scarring for my patients in a way that they haven't been able to take advantage of before. In addition, I've noticed facelifts are less common in the Middle East than they are in Hawaii and the United States. I do believe that this is because plastic surgery in general, cosmetic surgery, has a longer history in the US than it does in the locations that I'm going to. Plastic surgery is a little bit newer there. It's something that patients still need to discover, and patients are maybe a little bit less knowledgeable about the things that they can do to improve their appearance. I think the first wave of plastic surgery in the Middle East was really focused on the body and body contouring. And this is because a lot of patients there have had bariatric surgery, weight loss surgery. It's very common there. So for me to do body contouring surgery is much more common than for me to do a facelift in the Middle East. So I'm able to bring my unique experience of having done facelifts over the last 25 years, including my deplane technique, which is the best and the most effective way to perform a facelift, to the Middle East. And this is something that patients really are taking advantage of and very interested in, and something that I'm doing more and more of. And I'm really enjoying bringing these techniques and the ability to really rejuvenate somebody's face to the maximum degree when I do these procedures in Dubai and Doha and Kuwait. So as I just mentioned about body contouring surgery, this is something that I started doing about 20 years ago in Hawaii. I think around 20 years ago was really when patients really started to undergo what's called bariatric surgery, which is weight loss surgery. And this surgery where they do something to your digestive system, and this is usually done by a general surgeon, either reducing the size of the stomach or rerouting the way that the food passes through the digestive tract. And this allows patients to lose a significant amount of weight. When I first got to Hawaii around 20 years ago, this was a field that was just starting, and I gained a lot of experience doing what's called body contouring surgery. So patients who have lost 100, 200, even more pounds usually have a problem with very loose skin, because as they're larger and they get smaller, skin does not shrink back and patients have excess skin problem. So contouring surgery is the removal of the skin to improve a patient's appearance after significant weight loss. I noticed after this kind of surgery started in the US, it really caught on in the Middle East. So I noticed that after I started treating patients in Hawaii and the wave of patients who are undergoing that kind of surgery kind of died down, I did even more body contouring surgery over the last 15 years in my visits to the Middle East. So while this surgery is less common because of drugs like Ozempic, I still do see a lot of patients who've lost a lot of weight through various types of bariatric surgery. And I can tell you that I'm one of the most experienced surgeons in body contouring now because of all the patients that I did initially in Hawaii, then all of the cases that I did over in the Middle East. So that's really helped my patients here who need this kind of surgery now, because I can do virtually any type of body contouring surgery: the arms, the abdomen, the back, the breasts, the lower back, the thighs, because of all the experience I have in this type of procedure. So these are some of the ways that I've benefited both my patients here in Hawaii and in the Middle East, traveling back and forth all the way across the globe. And as a plastic surgeon, I really enjoy being able to go to a completely different location and culture and practice what I do. I've always loved traveling and being able to work I think adds even more to the experience of traveling, and it's something I really enjoy. So hope you like this content. Please give us a like down below, give us a comment, subscribe to this channel if you're interested, and we'll see you next time.